So Greer, when you're using Bellafill for acne scarring, how are you using it? What do you do?
It depends on the patient and on the situation, but oftentimes I find with acne scarring, especially if they're old acne scars, patients may have some volume loss as well as some of that adhesion with the scarring. So sometimes I just use a micro cannula, and I know traditionally people will use needles to actually excise a scar and help lift it up. But I found that I can use a cannula to do the similar thing with less trauma. And then if I need to do some additional lifting of that scar, I can do it with a straight needle. But I think for the most part, I found that using cannula works just as well. I don't know if you have the same experience.
I would say, again, I'm so partial to cannulas
Right.
that what I've been finding myself doing is I've been using like a 30 gauge micro cannula to go in
Nice.
very tight to kind of do subcision and break up
Right.
that adhesion or that attachment of the epidermis to the subdermis,
Right.
and then I put a little bit of Bellafill in under there.
Right.
To me, one of the interesting things about the study that led to FDA approval of Bellafill for acne scarring was that almost 50% of patients that didn't receive Bellafill that simply had subcision with saline had improvement of acne scarring.
Right, that's correct. So, you could even try treating an acne scar with, say, Juvederm. It's not going to last, but the patient can have an idea of what it looks like. But the long-term effects, really, if you use Bellafill and it's FDA approved, and to get that FDA approval for both lines, wrinkles, volume loss, and now acne scarring, it says a lot for that product, I think.
Well, and clearly Bellafill outperformed the placebo or the saline placebo, but I think to me it makes me realize that subcision works. Bellafill makes it work better.
Right.
And then we have all the modalities we've had for a long time. Fractional CO2 laser, microneedling is coming to the fore for treatment of acne scarring. Some of the more superficial lasers to treat pigmentary changes. I mean, there are so many things we can do now for people with acne scarring. It's really an exciting time.
And I like doing the microneedling with PRP, which is your own plasma. You draw your blood, you spin it down, you collect the platelets, the plasma-rich in platelets, and those stimulated growth factors actually help the skin heal quickly. So you really don't have any downtime, even with an aggressive microneedling treatment.